Hello, this is Dr. Arhiri with Premier Smiles. Today, we're going to ask some questions regarding root canal treatments. A root canal procedure, usually it's performed when the nerve inside the tooth is dying or is dead and was affected by bacteria or mechanical trauma. In most of the cases, patients complain of pain. It can be throbbing, dull ache, pulsating pain, which can keep you up at night. Swelling, it's part of the process as well. And in that case, usually we advise the patient to seek the help of a dental professional. Normally, endodontists are the ones who perform root canal procedures. However, there are plenty of general dentists who have the necessary training to perform safely and precisely a root canal procedure. Most of the times, it's not recommended to delay root canal procedure because it can change into a pre-bed infection, which can affect the rest of your body, and a lot of the times the patients might end up in the emergency room. Root canals, they're not painful. They're usually done under local anesthesia. They're performed safely, and afterwards the patient might experience some discomfort, some soreness post-operative. Most of the times the patient is anesthetized using topical anesthesia first, and then injectable anesthesia with different kinds of anesthetics depending on the severity of the infection. The process for root canal is primarily is basically anesthetizing the patient. After that, the tooth is isolated. Most of the times you can use a rubber dam, and then the tooth is accessed. The decay is removed from the tooth if that was the cause of it. And after that, the nerve is removed safely from the tooth. The canals are disinfected, are sterilized pretty much, and then they're sealed off. Most of the times, a root canal procedure is completed in one visit, which ensures the most success. Very rarely the root canal treatments are completed in more than one visit. During the root canal procedure, when the nerve is removed from the tooth, at the same time, the blood supply is cut off from that tooth, which means from that point on, there are no more nutrients coming back for the tooth, which weakens the tooth and makes it more prone to fractures or cracks or basically losing the tooth completely. So that's why it's recommended for that tooth to be reinforced with a porcelain crown and avoid possible to lose the tooth completely. Depends of how the alternatives for root canal. It depends of the severity of the infection, the severity of the tooth destruction from the decay or mechanical trauma. If there is too much decay and or the tooth is pretty badly destroyed, at that point the alternative of choice would be to extract the tooth, and then you can replace it with something else, with an implant or a bridge, or these are the options you have with that. The best option is to try to preserve your tooth if it's possible. There is no possibility of saving the tooth, then an implant is a wonderful choice option, pretty viable if it's done safely, and pretty much that implant along with the crown on top of it, they behave and perform like a normal tooth. A gum boil after root canal, it can be caused a lot of the times from reminiscence of bacteria inside the gums, and a lot of the times that's treated with an antibiotic. The reasons for root canals infections can vary. Some of them, a lot of times, if the root canal wasn't performed correctly, or the bacteria wasn't completely eliminated from the tooth, the decay wasn't completely removed from that particular tooth, that can cause a root canal treatment failure. When a tooth is fractured, that fracture cannot be repaired, unfortunately. However, there are quite a few cases where by performing a root canal procedure, which means removing the nerve from that tooth, it gives relief to the patient, and with a crown cemented on top of the tooth, that patient can function with that tooth for quite a while. Yes, root canals are very safe. They're done under sterile conditions. Everything is disinfected properly, sterilized, and sealed accordingly to prevent any more bacteria from getting inside the tooth. The bone, after a root canal, the bone doesn't really grow back. Always, whatever bone was lost, it's pretty much gone, and you just have to try to make sure no more bone loss appears in the future. Root canals can be covered by your dental insurance. Depends of the plan you have. There are multiple plans and insurances out there. and they cover different percentages out of the procedure cost, anywhere from 100% to pretty much not having any coverage at all. Thank you for listening to all these answers. Hopefully they were helpful. This is Dr. Arhiri with Premier Smiles. If you are in need of a consultation, feel free to give us a call at 610-647-7611.